Hello, everyone. Good morning or afternoon. And my name is Layla, as was mentioned, and I'm one of the coordinator for the Social Prescribing Program here in Chilliwack and Hope. We were able to get enough funding to have their own community connector for the city of Agassiz. So today's session, I'm hoping that after we finish with this session, you will be, first, thank you for giving me this opportunity to come and talk about something that I'm very passionate about. And hopefully at the end of the session, you'll be able to understand the role and the impact of social prescribing in the community, recognize the importance of community partnership, as well as identify strategies for effective discharge support. Next slide, please. So in the introduction, you guys heard the word or the term social prescribing. Some of you might be familiar what it means, and some might not have heard of that term before. So basically, social prescribing in a nutshell is a program that is funded by the government, managed by United Way. We started, as it was mentioned by Lisa in 2020 as a pilot program. And the initiative was to make sure that we connect senior with appropriate resources that are in the community to improve their well-being. To alleviate loneliness, isolation. So all of these are the mandate for the social prescribing program. So I would like you to keep that in mind as I'm going to ask you to picture this. You're a 79-year-old living in the community, doing pretty well on your own, independent, until one day you're being rushed to the hospital via ambulance because of an illness or a problem. You get admitted to the hospital and you're in there for what seems like forever. And before you know it, people are talking about discharge. You're going home. You notice that you're a lot weaker than what you used to be. You notice that the thing that you were able to do with ease are becoming difficult and you're struggling with them, yet the discharge is done and you're supposed to go home and carry on. Your ride home, most likely a taxi that will just drop you in front of your building. And again, you're expected to carry on. This is not a story. This is an actual case. This gentleman was hospitalized for a long time and he was discharged. And along with the discharge, there was a referral that was made to Chilliwack Community Services for the Social Prescribing Program. And the next day, post-discharge, I'm so excited, I'm thrilled to call this gentleman and share with him all the exciting opportunities and the social engagement that I will help him connect to. Very excited, to say the least, and until he start talking. And as soon as he start talking, when he finished, I was speechless because he was trying to explain to me what it looked like for him to come home. He said the taxi dropped him off in front of the building. He managed to get to his unit, and it was not easy. He finally opened the door, and he's trying to get in with his walker. There's clutter and chaos everywhere. These emergency personnel, they did a great job whisking him to the hospital and getting him the treatment that he needed, but they did not think ahead to make sure that the clutter or the area is cleared so he can get into his unit. So he had to struggle getting through the door, and then it was a big task, so he decided that he's going to spend the night in that recliner. He wasn't going to deal with it. He was weak, he was tired, he was overwhelmed. The next morning, he wants to make some breakfast, so he goes to the kitchen, and he was not surprised because he was in the hospital for a long time. Most of the food that was left outside was rotten. He had a kitchen table with the fruit bowl, bunch of fruit flies all over it. He tried to make some breakfast. The bread was molded. The milk was expired. He couldn't even make a cup of coffee. And here I am calling him with my cheerful voice, trying to connect him to socially. I felt silly, honestly. I felt silly. And I was speechless for a minute and tried to just understand everything that he was trying to tell me. At that moment, I realized that, yes, the social prescribing is supposed to mediate issues like isolation, but this type of isolation that hits you when you're most vulnerable, as you are discharged from the hospital to the community, has to be part of social prescribing. Fortunately, I have great community partners, and I shared my concern and my worry and my stress with some of them. And together, we created this Discharge Project pilot. And it was a pilot, and you could imagine it was a great idea where we can create this project where we can assist client that discharging from a hospital by providing psychosocial, nutritional support for these individuals that are isolated and vulnerable. As you can imagine, the whole idea is quite big, and we needed to recruit a lot of people and a lot of organizations. So the Compassionate Neighborhood took on this initiative wholeheartedly, applied for a grant, the seed grant, and secured the funds, introduced Chilliwack Community Services to the Discharge Project organization, which I did not know they existed before this. And together we sat down, we talked about the project, what we want it to look like. We came up with mandates, we came up with criteria, guidelines, surveys. And when we were happy with with how it looked, we presented it to Fraser Health. So if we can go to the next slide, please. So as I said, it required a lot of collaboration. So the first one being the Compassionate Neighborhood, starting it all off by the grant and getting us all connected. Then we came up with the idea and we presented it to Fraser Health. Fraser Health's role in this program was basically to promote the program, educate staff on how to identify seniors that are perfect for this program, and also be clear and transparent in communicating with us about the client and about giving us feedback on how well this program is doing. Once the hospital will identify a client, they will send a referral to the Social Prescribing Program. And once I get that referral, I'll make a phone call in the hospital and talk to this client, introduce myself, introduce the partners, tell them how this will work and how much support they will get once they get home. When I start talking about all this and explaining to them how much support they will be getting right away, and immediately the level of anxiety and stress goes down. I can hear it in their voice. They're excited to go home. It doesn't sound like this big daunting task that they have to take care of by themselves. During that conversation also, I gather information regarding what else do they need when they get home. Do they need equipment that we need to kind of coordinate pickup for? Do they need medication? Most of the time, these people get discharged and they get right back to the hospital because the discharge was not done effectively for some time. So we try our best to kind of prompt the client. Do you have that? Are you ready for that? What do you need at home? So once I get all of that information and make sure that I introduce the social prescribing program, for me, that was a crucial point, because me speaking about social prescribing at that time, without going into detail, build that rapport right up front, because they understand now social prescribing will help them, support them transition to the community, as well as to help them connect to different programs. So they become more willing to participate later on. Once I do that, I send my report to the Cherish Project staff. They will look it over. They make sure it meets all criteria, and then they will find the matching. They will match that client with the right volunteer. So the Cherish Project's role in this project was to recruit, maintain, and train volunteers, which was a big task, and they did it beautifully, despite all challenges that we run to starting this program. They maintained professionalism, and they were able to support every single referral that I sent their way. So once that's done, the volunteer will visit with the client at the hospital, establish that report early on, get the list of groceries they might need, and that's the seed grant. Again, we use a $50 gift certificate for each client that needs it going home. So we use that $50 to buy milk, bread, eggs, whatever they need immediately as soon as they get home. Sometimes they would need other things, toilet paper, whatever they need, we'll try to purchase that for them. And the volunteer will visit with them on discharge day, bring the food, the cooked meals, the groceries, and spend some time with them, follow up with them for a whole month post-discharge if the client chooses, either via phone or in-person visitation. And this worked really beautifully. The program was very successful. Fraser Health noticed how much we were doing, how grateful the clients were. We received numerous referrals. Unfortunately, not all of them met our criteria, but at the end of the pilot, we were able to service about 26 clients successfully. And we, again, Compassionate Neighborhood reported all our finding to the funders, and we were pleased with this outcome. After the pilot was over, Cherish Project committed to continue supporting Chilliwack Community Services and provide this particular service to our seniors. So we are on our second year. We're still helping those seniors. We encounter so many struggles and challenges getting this program started, and we still run into challenges now. I'll list a few of those challenges. For example, coordinating discharge dates and time. That was one of our biggest problems. As you all understand, hospitals are very dynamic and things are changed, and discharge dates are like changes in a split second. And sometimes we have to scramble quickly to match the volunteer and get everything ready. But it's hard to get it done that way. So last minute discharges were also an issue. Inappropriate referrals was an issue because we have to decline them after going through the whole process of intake. Inappropriate discharge or rush discharge still remain to become one of our biggest challenge, because we've noticed that a lot of seniors get discharged and then two days later they're back in the hospital. Despite all of these challenges and funding as well, sometimes these seniors need more than just $50 gift certificate and 2 meals. They need other things for discharge. So funding was also an issue, but we were able to figure something out for that. So despite all of these challenges, we continue to provide the service, and we are still very engaged and very excited for this program. And that's simply because we all as a team shared so many success stories. We've delivered so many meals, so many groceries. We picked up so many equipments. Some of these seniors made new friends for the short period. Some of them made friends for a life, we hope. Some of these seniors actually made their last friend before they left this life. And that takes me to my next story. If we could go, actually stay on this in this slide. I would like to share with you end of life support that this program was able to provide, something that we did not see, but it ended up happening, and it was just like the cherry on the top, honestly. So this client was referred to us as a discharge client, and he was quite frail. He did not have, at that time, he did not have any official or non-official support. So his only family was an ex-wife that was trying to visit and help. But he needed a lot of support, and these volunteers helped him day in and day out. And this gentleman kept going in and out the hospital until finally he was, we were told that that was the end and he's dying. These volunteers, as well as the staff at Discharge Project, visited with this client for a whole week, sat there, prayed for him, prayed with him until he passed. And Janita, who's one of my favorite human beings, wrote a little something, and I'm not going to read the whole thing, but I'll just read the last bit of it. She says, although it was certainly heartbreaking to watch this man's life come to an end, it was an immense privilege to be there to pray for him and to acknowledge his intrinsic value. Thank you for enabling us to do the work that we do, cherishing life. So that's one story. Another recent story that just happened last weekend on Friday, one of our clients that was not doing well in the community with multiple complex case. We were trying to help support her as much as possible. She was connected with a volunteer, and that volunteer kept visiting and helping and supporting. And then finally, one day she got admitted and she was diagnosed with multiple terminal diagnoses that did not help the situation. She was already fragile, depressed, and so much was happening. Unfortunately, or fortunately, depending how you look at it, she signed for MAID and she decided to end it all. That volunteer that was attached to her visited with her many times, took food, sat there, listened to her, replaying her whole life. She doesn't have a lot of family. She has one daughter that lives outside of Chilliwack. So that volunteer was there for that client, as well as the Discharge Project, as well as myself. We all visited, we all prayed until Saturday, 2 p.m. when she had passed on. So because of all of this, and a little bit more, actually, I would like to also share the last bit here where I put Facebook and community engagement. Discharge Project also enhanced that bit. Many times we get referrals for discharges for clients that go into assisted living. And I don't know if you guys know about assisted living, but they have this thing called a must list. Now, this list, the senior need to get everything on that list in order for them to go to the assisted living. So the discharge is practically on hold until all of that stuff is bought or found or something. Tremendous pressure on the healthcare system. The staff in the hospital, they don't have the time to go out to the dollar store, pick up. And these items on the list could be as big as a bed or something as silly as a shower curtain. They're not going to get in, they're not going to be discharged until they have a shower curtain. This is a real story. So so what the Discharge Project did for them is we use that $50. If that's what they need, we'll get the shower curtain and get them out to their home as soon as possible. And if they need something that we cannot afford to pay for, like a bed, I would post a little ad on Facebook asking for community engagement, introducing myself and telling them why I need this particular item. And I tell you, there has not been once that I've asked for anything and I did not get it. And I've asked for beds, for fridges, for stove, for phones, you name it, I've asked and I've received. We have a very generous community, and I feel like something like that and allowing the community to take part of something as beautiful as supporting a senior that is going home is just, and again, cherry on the top. We did not see that becoming part of it, but this is what this program is turned into, and we are very, very proud and happy and honored to be able to take part of this. And again, thank you very much for allowing me to come today and speak about something that I'm really, really passionate about. Thank you. If there's any questions, I guess we can do questions next.
Thank you, Layla. That was a great presentation. I personally really liked your stories. I really liked how you evolved the program to have community come in and support. That was an amazing piece. I do have a set of questions here for participants that I can facilitate. But before I start that, does anyone want to jump in and ask some questions about the program and have Layla respond? Okay, not seeing any hands up. Okay. Okay, so Layla, so I have some questions for you. Given that this is a really new and unique social prescribing program, and it really successfully bridged the partnerships between the health system and community organizations. And again, I really loved how you spoke about how community really stepped up to the plate to help you guys launch this program. Could you speak a little bit more about how you developed the partnerships? What kind of work went into it? I heard that you spoke about the Cherish Project. Maybe talk a little bit more about that. So yeah, talk a little bit about how you successfully bridged these partnerships.
Absolutely. So as I said in the beginning of my presentation, the mandate of the social prescribing is to reduce loneliness and isolation and all that good stuff. But the whole discharge or taking care of the client during that vulnerable time, it was not, it was not spoken about, or it was actually a gap that was discovered by the social prescribing program. So once I discovered that gap, the beautiful thing about Chilliwack, I think, is we have a working group and we meet monthly and we discuss issues and gaps that we run into as community partners. And together we try to come up with ideas. Sometimes these ideas come up nicely like this, and sometimes we run into so many blocks and barriers. But how the whole thing started is first for that story that I said, the fruit fly story. I shared that story with Connie the time it happened, and I was quite frustrated because I did not know what to do. Of course, immediately I went and I was able to help that gentleman in some capacity, but it is not my role, and it's not sustainable for me to be able to do that for each client. And we knew that there must be, if this is one case, we knew that there must be more of that. So once I brought this to Connie just, she does that with everything. She took it and ran with it, and she opened my eyes to this. I was new also to this program, so I did not know how much collaboration we could do and how we can get this off the ground. So her first thing was, well, let's bring in another organization that could help us recruit the volunteer. And Connie decided that she's going to apply for do all the paperwork for the grant and applying for it and securing the fund. And then once we all got together, the Compassionate Neighborhood, Cherish Project, and Chilliwack Community Services, we all kind of decided of what it's going to look like. We kind of had an idea of what we want it to look like. And then we presented it to Fraser Health. So I feel like the reason why it worked so well is, first of all parties recognized that it is a gap and nobody else was doing anything about it. So something has to be done. Again, the fact that we have in multiple organizations do little pieces, it made it possible, because it would have been very difficult for me to do the grant and all the paperwork and the feedback after the pilot was done. So Connie took care of all of that. Cherish Project was able to recruit and train and maintain these volunteers until today. And that's a huge piece, because that would fall on me if I was going to do it alone, to be able to recruit, manage, and train these volunteers, apply for that grant on my own, and manage this whole thing. But the fact that we have so many different people or organizations working together made it a lot easier. And then Fraser Health also, it was a big step for them, because one of the issues in the beginning was like, how are we going to allow like all issues about confidentiality and how are we going to do this in the right way, and having introducing the volunteers to the client. So they had to work on their own internal policies and figuring out how they're going to promote the program, how are they going to educate their staff. So like, again, every organization had particular role to play in to make this program become what it is today. And it's basically just understanding that there was a need and the willingness to collaborate and do something about it.
That's great, great. Connie, I see you're online. If you want to jump in at any time, please feel free. I know you have a wealth of experience as well. So another question I have, Leila, is, you know, what are your words of wisdom or your advice for people and organizations that want to get this type of programs set up and, you know, really, you know, get people behind it to support this type of initiative?
Don't give up, because things can get a bit frustrating at times. And it's nobody's fault, because, like, again, as I said, hospitals are very dynamic, staff are changing. A referral could be sent in by one particular staff, and then that staff is away on a vacation or no longer work there. So being able, like, I feel what made this program so successful is I feel everybody that's working together has the intention of helping. So even if there's some struggles and obstacles and whatever, we are not quick to blame a certain organization for it. We just, priority is how can we help that senior transition safely to the community. So even when we get the last minute discharges, we of course we take that back and we give that feedback to Fraser Health and say, can we work on this? What are ways that we can make this better? When we see these discharges of clients that come in and then 2 days later they're back in the hospital, we feel discouraged and we feel stressed out for the client. Sometimes it's inappropriate discharges. The hospital will want to try to send the client to the community when we all know the clients are not going to thrive well, and all the resources put together that we can provide to them probably not going to be efficient or sufficient. So things like that could be very discouraging, I think. And Connie, feel free, or Janita, if you're on the call, feel free to add to it. But I think not giving up and being consistent and being transparent with all the finding with all partners, and working together with the intention of we are trying to help somebody with the as less barriers as possible for client to be part of this program. We're trying to do that, but we also have to think about our volunteer and the safety and all that stuff. So one of the reasons why we will not accept a client if the client is living with other people in the home. So we want to help a specific targeted community, the one that does not have any kind of support. And I feel like getting all of that organized with Fraser Health to make it smoother is the biggest challenge. But even now, with the grant funds run out, as I said, Church Project continue to help me support or provide this program. We figured out a way for funding, so they decided to take on the portion for the gift certificate. They're paying for it, and Meals on Wheels agreed to provide us with some meals. These are the meals that we're going to be giving to the senior. So we made it work one way or another, and it's still going. And yeah, it's awesome.
So it sounds like this program is still going to continue on.
Yes, this is the second year. Yes.
Great. I see. Oh, go ahead, Connie.
Yes, I think also if there's a new community that wants to initiate this, it's really helpful if they already have a social prescriber in their community, right? Who has built a connection with their local hospital discharge team. Because that would be part of the starting this initiative, you would have to have some collaboration there.
Great, great. Layla, how about you talk about how you became a social prescriber? I'm interested in learning about that.
Well, I had no idea what social prescribing was, and I was at that time, it was COVID time, 2020. I was taking care of an elderly lady, and I was doing pretty much what social prescribing is, but only for one client, and that was kind of awesome. And we both moved into Chilliwack, so we both new to the community, and I had to do my research to see where I can take her for karaoke, where I could take her for art classes. She was a very social person, so I gained some kind of understanding of the community at that time. 2020 March, she passed away, and I found myself looking for a job. And that I saw that posting, I had no idea what it meant, and neither did my organization, to be honest. It was a brand new program adopted from a UK model, and they told me, well, this is what they want to do with it. What can you do with this program? So they're like, you can make as many mistakes as you want because this is brand new. We'll support you. And CCS has been absolutely incredible because they had not put any limitation on how or where I could take this program. So you will find that social prescribing looks quite different in different communities. And it's mainly because the prescriber or the community connector, such as myself or my partner Joyce, who's just got hired a few months ago, our role becomes to really assess the community and see what are the gaps, what we need to establish here, what is popular, what is not popular, and taking that information and doing something about it. So we make it look different. So I got hired for the job. I started, it was very exciting. It helped that Chilliwack Community Services had really, really good relationship with the Division of Family Practice, with other community partners. So I fit in really easily, and I found a lot of support. I met Connie. She was one of the first people that I actually was introduced to and was told that she's going to be my best ally, and they did not lie. And that's it. And slowly just you start hearing things, and the first case is very exciting, of course, the first referral. Again, you go into it thinking, social connection, we need to get people out, and it was COVID time, we're telling them to isolate but then yet socialize. It was very confusing, and we had to be quite creative to be able to meet that criteria or idea of the program. But as things got better and programs start opening and we're able to meet in person, we're able to do more visits, the program just grew, really grew. And now we have my colleague Joyce, who just got hired to help me take care of clients at Hope, and they also hired another connector to take care of clients that are in Agassiz. And then we hear more and more social prescribing programs appearing in different parts of the province. In September, we actually have a national convention where we're all going to meet and also talk about social prescribing. So it's very exciting, and it started as a pilot. We did not, when I was hired for 28 hours, and I was told that it might be a thing, it might not be a thing. So I'm like, okay, we'll give it a try. And now it's very successful, and I see it just growing even bigger than this.
Yeah, it sounds like there's a really huge need for these types of programs, and I must say I'm quite impressed with your role and how it involves elements of community development and community engagement, and that the team has been very nimble and changed direction and is able to do that. You know, sometimes when we work with health systems such as hospital, that's a bit more of a formal structure and a system. So I really liked how you were able to adapt the program as well. And I did pick up on something that I wanted to ask you about as well when you started speaking about your program. So you spoke about isolation and how initially that you thought that didn't, you know, wasn't really a focus of the program, but you saw that this was a huge need, especially because clients were coming in at their most vulnerable. So can you talk a little bit about that dynamic?
Yes. So again, starting this program, not knowing the demographic, not knowing the actual need, it's almost like reading a script. So I would call the client and I memorized all the resources and all the outings and how to get to it and try to eliminate barriers. So if they needed transportation was huge in the beginning. Now we come up with something. We were able to purchase a bus, and now we're able to have these seniors go to these events, eliminating the transportation barrier. But initially, it was just thinking that, oh, we just need to get them out and socializing and meeting people. But and I felt like, okay, if everybody has the list I have here in front of me with all community organization and different things that's running through their organization, why do you need a social prescriber per se? Like I myself did not grasp the idea, but everybody else around me in the organization was very excited for my role. And I'm like, well, everybody could do what I'm doing. There's nothing special about it. But as I start doing it and understood that, hey, isolation is not just somebody just want to go out and have coffee. There's different type of isolation. And I also learned that isolation for seniors started way before COVID. So these people were comfortable being isolated, and they needed way more encouragement and kind of promoting these social events for them to come out. So they were comfortable the way they were, even though it was not ideal. So for me to come and try to change their mind about getting out and being engaged, it was a challenge. But having that Discharge Project gave me an in. So here I am. I'm going to provide you with the service that you actually need right now. When you get home, you need those meals, you need those groceries, you need somebody to check on you. And once they see, oh, okay, so these people can do something that I need. And once that's happened, then I go back and say, when was the last time you had coffee with a friend? When was the last time you went out for an outing? Would you try to come out to Connect Cafe once? We provide transportation. There is no barriers. So I have all these things that I list for them. And they'll be like, all right. I'm like, oh, I'm going to ask you to try it once. Try it once, and you know how, and then they would try it. And then most of the time I will have really, really positive feedback. And then again, we talk about it. Okay, some people say, well, do you have a cooking class? Do you have a gardening class? Do you have this kind of class? So we look around, see if nobody else is doing it, and we try to create something that would benefit that particular group the best way we can.
That's great. Does anybody want to jump in, ask questions or share an experience? Please feel free to do so. Saw something in the chat. Sandra, you had said there's a lot of value in what you are doing here. How do you recommend ensuring you are linking seniors to well-trained and supported volunteers or organizations? And do you provide training?
Okay, so initially when we started the Discharge Project, Connie can jump in and talk about it. I was not hands-on in the recruitment and training of volunteers. That was done by Church Project and Compassionate Neighborhood Society. So I believe it's one of the challenges to find the right people, and one of the role that Church Project plays is matching them. So they would try to know their volunteers, and they're like, oh, so-and-so would match really well with so-and-so. So that becomes a really important piece versus just any volunteer. So having that extra organization taking care of that one piece makes us feel good about it, that we are connecting a well-trained senior that want to do this specific task. So these volunteers are recruited for this specific task, and we like to keep them just for the Discharge Project because they're trained for that project. And I would recommend, if anybody's want to do something like that, is yes, recruiting specifically trained volunteer for that specific task. And Connie, if you go ahead.
Yes, so I do agree. It needs to have proper training. So we were doing it for our own volunteers. So that's where I supported the Cherish Project in training their volunteers, and then provided them with information so they could continue training new volunteers in this program. So I think just in summary, it's really important for people to know about, new volunteers have a great heart, and it's very easy to then do more than the boundaries that you have as a volunteer. And so that's one of the key things, is speaking about, what are our boundaries, and also about confidentiality, and then about communication, right? So it's just enhancing our communication skills as we work with older adults who may be on a dementia journey, or hard of hearing, or living with blindness, all those kind of things. So yes, I think if you're starting up a program, it's important to have a proper educational training session for them.
Great. Any other questions or comments people might have? Okay, so I'll ask a question about your clients. So how did your clients feel about the program? Like, you shared a little bit of the stories, but can you tell us a little bit more about some of the client reactions and the positive outcomes that you had?
So as I explained, at the end of the 1-year pilot, Connie collected, we all collected those surveys, the volunteers and surveys, the volunteer and the clients. And we did get really good feedback that encouraged us to know that we're doing the right thing, and we are supporting a population that needed this kind of service. Many positive feedback. For me, mostly I remember stories because I like, yeah, this is stuff we did. I feel like, I don't know, I can't think of any particular, but like even picking up equipment from the Red Cross, this was a huge deal for some of these clients. And knowing that somebody will go and get those for them, it is so important, because if they go home and they don't have anybody to pick it up for them, and they have to wait a few days until they're stronger or they're able to drive, that's the time when they're going to fall and something's going to go wrong. So we try our very best to get in as early as possible, as quick as possible before their discharge. And like I said, this is one of the biggest challenging, timing it right. So sometimes they get discharged without us getting notified, and we're playing catch up. But a lot of wonderful stories. Connie, do you have anything you want to?
Yes, I think as we are all unique, so are our older adults that benefited from it. So for some of them, it was huge to receive the warm meals. For others, it was huge to receive those staples, as the little story about, like if I've been in for a month and there's nobody to get me my basic food, what am I coming home for, right? And for others, it was also that check-in, that volunteer connection was huge. So it may be different for different seniors, but yes, the different aspects, we did get definitely positive feedback.
And we empowered them. Like we allowed the senior to choose the level of engagement or interaction with that volunteer. Some of them, they like Connie said, they really just needed the meal and the groceries or whatever. Not so much that somebody calling them, for a month or visiting them. They did not need that, and that's fine. We had to respect that. Some of them really wanted that connection, even beyond those meals and everything else, and they craved it. And those volunteers continue to support them even after the 1 month. Some of them gained a friend, or made a valuable relationship through this program. And again, the stories about the 2 deaths that we had really put everything in perspective for us, because we're like, okay, we were thinking about supporting this client to live, to transition to the community, get what they need. But then we've never really thought about, okay, who's there when they're leaving, like when they're dying? Like, is there anybody there holding their hands, praying for them, supporting them? And this is what this project has been doing, is supporting people, in their life journey. So it's beautiful.
Well, I'd like to jump in with that one too, is of course, there's the choice for going to hospice, and not everyone wants to go to hospice. So this was a case where this older gentleman did not want to go to hospice. So he wanted to go home. And so this is where the volunteer was a huge support for him, to allow him, at least for a little period, to go home, even though he had to come home back to hospital for passing away. Yet he received that connection prior and was given that comfort that volunteer stayed with him in his last days. So that's another very positive aspect of that project.
Yeah, and I really like in this entire presentation, you're actually telling the story of your program with your sharing your experiences, volunteer stories, the client stories. So I think that is just amazing. And I also want to say that I was really impressed with how you used social media and Facebook to leverage community support. That is very impressive. I actually haven't heard that before. So what was
wild?
yeah.
Yeah, it was wild. I mean, the whole Facebook thing, it again, an idea that came out of desperation. We needed this stuff. If you think about it, for a client to be stuck in a hospital and a discharge to be delayed because they don't have a shower curtain or a bed, it sounds insane to me. But then when you think about the steps to get these things done, you understand that the hospital staff most of the time don't have that kind of time. And the client is stuck in the hospital. He's not able to go and buy these things for themselves. And we don't have the funds to pay for everything. So I said, what the heck? And I start posting it. And, in the beginning it was a bit of a challenge because people did not recognize my name. Of course, they're aware, but there's might be scammers and all the stuff. But it didn't take long and people start recognizing, okay, Leila from Chilliwack Community Services, okay, needs something. And it's immediate. And it's so impressive that even the social worker at the hospital, sometimes they're like, how are you doing this so quickly? I'm like, I am not. I'm literally just posting it on Facebook and people just jumping to help us and donate mattresses and beds and all of that to facilitate a discharge. And when you look at the big picture and how much money the hospital save and how much stress the client is relieved of because it's put back on him. Do you have a family to go buy these things for you? Can you take a taxi and go buy these things for yourself? And some of them really can't, absolutely can't. And it's very, very heartbreaking. And to be able to just come in and I got a bed, taking the credit for it, and they'll, oh, Leila, how did you? I'm like, no, it's really the community is amazing, and they get it. They understood what we're trying to do, and I wish we could do even more advertising and community education about what are we doing and how it is a thing now. I look up for the community, people in the community to help me find a bed or find, because it's necessary to get that client to his home or her home. So
yeah, that's great. So everyone take note, if you're looking to establish a program, Facebook is your friend. And I also really liked with your sharing about how important community is to this type of project. Like, it really, when we talk about compassionate community work, what you've done here is really compassionate community work in a nutshell. You've managed to successfully leverage community to come together and look after our most vulnerable. And as we know in this day and age, that's a bit of a challenge. So my hat is off to you both. So thank you very much. Does anybody have any other questions or comments they would like to ask? Oh, I'm not seeing, it's like a shy group today. I can just keep asking questions. I do see it's almost 10 to, so I have someone. Okay, that was a thumbs up, not a hand up. So it is about 10 minutes to the hour. If Connie and Leila, you have anything else that you want to share, some hindsight, some success stories, anything that we've missed today, I'll invite you to put in a little tidbit for our audience here. Yeah. Other than I'll really promote your work. I think it was great. I was really impressed when your final report came in for the program, and wonderful, wonderful work and stories. So I encourage you to share your stories throughout your promotion of this program, because people will learn from this and they would be happy to support your program.
It's just too bad that Leila can't do it at the Altogether Symposium, but yeah, we would enjoy being able to. But yes, it does require teamwork. So I would also give that suggestion. If you don't have like a monthly table with the different organizations working with seniors groups, to try to set that up, because there you have the support with one another, right? And you learn to know what we always speak about, don't duplicate the work. There's so much other work to be done, that in this case, Discharge Project was a new group that wanted to work with seniors. So we saw they had come to ask me too, is, what would be areas? So this was an area that they would be given that helped to launch to carry out a special task for seniors in our community. So I would suggest that people would look at how can we bring the resources in my community to work together for those seniors.
I see Francis, you have your hand up if you want to go ahead.
Yeah, I was trying to figure out if this is in addition to the NAPCare program, or is it the gap between NAPCare and hospice care that's being filled with just the discharge patients?
So
Do you know about the NAPCare program?
yes, so we are actually separate from hospice, and we are actually community programs working more under the wider. So focusing, our organization works with trying to prevent and reduce social isolation and loneliness in our community, and working with caregivers in the similar. So we're not actually a hospice society.
Okay, okay.
It
And
just happened that those clients were going through death and dying as we were supporting them with discharge, because they keep going back in the hospital, and the volunteer will continue to follow with them for a month. And that's why we had the privilege to be part of these two stories. But really, the idea is to reduce isolation, empower the senior, get them connected to the community, and get them engaged, and get over that little hump of how awful you feel after you're being discharged from the hospital. And that's the biggest part of it, is just getting through that little hump after the discharge.
But of course, we are also working with many people who don't have a diagnosis of being in their end stage, but they, many of our people are dying, right? They are coming to our programs, we're supporting them, but they're not with, they're got a chronic condition, right? We're looking also at many that are living with mobility issues, health challenges, chronic health challenges, or even with mental health challenges, right? That also need that social connection and support. So, we could tell you lots of other stories from a wider, of what a difference it makes. So we are really treasured with having hospice societies, but we see there's a need for more, right?
Yeah, and I just want to say that that's a really great question, Francis. So when we talk about compassionate community work, this work exists within community outside of hospices. So our presenters here, Layla and Connie, are from a community organization. As they spoke about, they do different work in community. So that's part of this ECHO initiative. It's to show people that these types of programs exist outside of the palliative care system and the hospice system, that they are actually part of community as a whole. So thank you, because that really flagged me. Oh, yes. Any other questions or comments from people? Okay, I'm not seeing anything. So it's about 7 minutes to the end of the session. So if there are no other questions or comments, I'll close. Just going to check again. Nobody's got their hand up. Okay. So thank you, Layla, for sharing and being part of our discussion today. And also to you, Connie, for jumping in and helping speak about the program that Layla has run. So we hope everyone has enjoyed the session today. And there will be just a short survey that'll pop up when you leave the session. If you could kindly complete that, it takes about a minute or two, that would be great. So our aim for the next steps is to provide everyone a copy of the presentation recording, the session summary notes, and other resources. That'll be within a week. And just on close, I'll just remind everyone, Esther, if you could pull up the last slide. Okay, so our Altogether Symposium is coming up on October the 4th. We will be having a social prescribing panel at the event. The registration is open. We've just posted the agenda, so we'll be posting the agenda on our website. And for those of you who have registered for tickets. You'll get an email link from Huva asking you to download the event app, and then you can see the agenda and the speakers. So we're really excited about this. This is our biennial altogether symposium event. This is our second year. We've almost tripled our growth since the first session. So we're looking forward to hosting everyone for this symposium this year. There's the link to our website there. And again, the agenda should be up this week. If you get our Centerpoint magazine, you will also see that posting as well. So lots of great sessions, lots of great speakers. We're really excited. We hope you will join us at the symposium. So on that note, I will thank everyone for your time, for spending your lunch hour with us. Thank you to Layla for your wonderful presentation. Very interesting program. I'm excited to see if it grows further. And I'll wish everyone a good day. So thank you, everyone. Okay, bye.
Thank you. Bye-bye.
Thank you.